Is Christine Ahiale, a public health student at the Department of Health System Management, University of Port Harcourt, Nigeria, in West Africa. My project is a systematic review of predictors of quality of life among type 2 diabetic patients in Ghana. My supervisors are Professor Charles Tobin West of University of Port Harcourt, Nigeria, and Dr. Martina Yanori of University of Health and Allied Sciences, Ghana, in West Africa. Over the past decades, incidence and prevalence of type 2 diabetes has risen sharply, and if treatment is not sought early, it leads to serious damages to the heart, the blood vessels, eye, kidney, and nerves. Systematic review has two main aims. One is to identify factors that influence quality of life of type 2 diabetic patients. Two, to determine poor mean of quality of life among type 2 diabetic patients. Several databases were used in this research, which yielded 456 potential studies, and 119 studies were screened after removal of duplication. Finally, only 4 articles met the inclusion criteria. Tools used in this study are Joanna Briggs appraiser tool to satisfy inclusion or exclusion of articles, and random effect model was also used to estimate the mean quality of life, and Atlas TI was used to analyze the qualitative outcome of the study. Atlas TI was also used to analyze the quantitative bits of the systematic review. The Prisma flowchart of the systematic review, as I've already explained in the methodology. The study revealed that 1. The poor mean score of quality of life among type 2 diabetic patients in Ghana is 62.67% with a confidence interval of 95%. 2. Mental health factors that predict quality of life among type 2 diabetic patients are anxiety and depression. 3. Heart complications and comorbid conditions associated with poor quality of life are cognitive failures, interpersonal sensitivity, renal insufficiency, and diabetic complications. 4. Age and employment were only socio-demographic factors that affect quality of life of type 2 diabetic patients in Ghana. Finally, the study revealed that medication adherence and social support are positively associated with quality of life among type 2 diabetic patients in Ghana. Conclusion: articles included in this study are limited by scope and geographical area. There is the need for comprehensive study with wider scope and geographical area to truly comprehend factors that predict quality of life among type 2 diabetic patients in Ghana. These are some of my references.